Good afternoon, and thank you for the introduction. To Áthas Orm a bheith live in you. And it's great to be with those of you gathered in the room today in person, but also I want to welcome those joining virtually. I know there are a number of guests from around the globe and indeed around the country. So to all of our local and national and international guests, Céad Míle Fáilte Galéir. So I'm very pleased to join you for this important conference today. And from the range of voices in the room and the makeup of the participants over the 2 days, it's clear this is a very important conversation, needless to say, but it's also a conversation that is taking place and moving forward, moving from the discussion realm to the sphere of actions, and that's where every conversation should finish with an action plan and a number of initiatives. So I want to thank the HEA, the Higher Education Authority, for convening this event today and yesterday, and for your leadership in this space as well. I want to acknowledge a few people, Professor Philip Dodd, Deputy Chief Medical Officer at the Department of Health, for his contribution also, and the collaboration between our departments across health and further in higher education. It's such an important partnership because meaningful progress in this area depends on our two departments working together, and indeed I work very closely with the Minister for Health, and that continued engagement is vital to our continued success and supports. I want to thank Dr. Jennifer Townhauser and Dr. Vicky Squires also for bringing international perspectives to today's discussions. And contributions like these challenge us to think more broadly, learn from others, and strengthen how we work and learn together and how we can support each other in different ways. Because ultimately, regardless of our place in the world, in every sense, geographically, socially, economically, wherever we may happen to be, we are working for the same goal, really. Healthier, more supportive learning environments for our students, for our staff, for our shared communities. It's important to acknowledge the work of Irish institutions in progressing the global health promoting campus agenda. And in particular, I want to thank the University of Limerick team, including Professor Catherine Woods and the team there who delivered a global set of guidelines for institutions to progress student and staff health and well-being. And I was delighted last year, I think it was in December, to deliver the opening address virtually on that occasion at the launch of the Limerick Framework. The Limerick Framework for Action, advancing the global health promoting campus agenda, to give it its full title. And I know that was a huge success. And today is another demonstration that we are keen to further follow on with actions to move forward, to work together globally and locally, and to lead by example. Níorchar Cárla Céile, by being stronger, by being together in harmony. Of course, the Limerick Framework itself was an output of the 2025 International Health Promoting Campuses Conference hosted last June by the University of Limerick in consultation with Atlantic Technological University, the two campuses and colleges coming together, and again supported by the HEA. And through the HEA, Ireland is an active member of the International Health Promoting Campus Network. Since 2015, the Okanagan Charter for Health Promoting Campuses has guided their work, including the development of the HEA Healthy Campus Charter and Framework. Ireland is proud to drive the health promoting campus agenda globally through the launch of the International Limerick Framework and through our national policies on student and staff health and well-being across higher education. Mental health and the well-being of students is a key strategic priority of mine and of my department, and we have provided 37.9 million in additional funding in student mental health supports since the foundation of the department in 2020. And this funding is to further support higher education institutions in meeting the mental health and well-being needs across our campuses and in implementing the National Student Mental Health and Suicide Prevention Framework and the Healthy Campus Charter and Framework. I am absolutely committed to this work, and as part of the most recent budget, I ensured that an additional €1 million was secured specifically for student mental health and healthy campus initiatives. That extra million brings the total ring-fenced for these supports to €6 million today. And before I came here this afternoon, I was at an event in Portlaoise meeting with students' unions, with learners, with educators, and people from across the further and higher education sector. And I was actually noted a number of those spoke. We had a number of table discussion and workshops. A number of those spoke about the impact of the mental health supports that we all provide through our campuses and the criticality of those. And it was really encouraging to hear the impact that those initiatives are making. A project supported through that funding is the Student Counselling Services Database, which has been developed to house standardised data from higher education institutions, student counselling services, in collaboration between psychological counsellors in higher education Ireland and researchers at UCD. Establishing this national dataset will enable the compilation of comprehensive reports on the student cohort at national level and allow institutions to understand their own positioning within national data trends in a timely and meaningful way. And I want to thank Professor Barbara Dooley of UCD, who is here today, for her work on this important initiative. As you all know, an important part of our work on student mental health is the revision of the National Student Mental Health and Suicide Prevention Framework, and that revision and that reassessment has currently been undertaken by a team of researchers from ATU and UCD in consultation with the HEA Student and Staff Health and Wellbeing Advisory Group. The revision of that framework will include the identification of robust and meaningful indicators that can measure quality of provision and the ability of HEIs to provide adequate, comprehensive levels of mental health support to their students. And I'm delighted to see also the launch of the HEA report, Enhancing Student Engagement and Belonging through Collaborative Partnership, by a team of researchers at UCD and supported by the Department of Health. The report provides valuable insights and recommendations for institutions to further support their work on student belonging. It is important to acknowledge the significant work that has happened across institutions, and all of you in the room here today and online have played an integral part in this work. It is great to see examples of over 30 healthy campus case studies on display here today, and I know there are over 70 case studies highlighted on the HEA website. Our role, collectively, is to support students, not just in accessing education, but to succeed within it. Not just to survive, but to thrive, be supported, to be well, to be happy, to be able to partake holistically in education. And we know that time spent in further and higher education is usually a period of significant transition. It's often a time when habits are formed, habits that go on to shape long-term health, well-being and life outcomes. And when our students graduate and progress through, today's students are tomorrow's leaders, decision makers and contributors across society. So this work matters. How we shape the generation coming through education today builds the generation to formulate policies tomorrow, and more importantly enables each student individually to not just survive but to thrive and to live life to the fullest, including their educational journey. So I want to thank you for all that you do and continue to do. Keep up the great work. Keep embedding well-being at the heart of your institutions, because this is essential work, and it really is, as I saw firsthand today at the student symposium in Portlaoise, it is making a real difference to students' lives and their experiences. So as the conference draws to a close, I'm going to leave you with another little seanadh, an Irish saying, "Is fear an sláinte ná na táinte." Health is better than wealth. If you can have both, you're really going places. But certainly, if you don't have one, you won't have the other. And I think that perhaps puts the responsibility back on our shoulders and highlights the importance of this critical work. So I hope the conference was a great success. I hope you continue turning words into actions, building on the foundations each time, building on the success of last year, the Limerick Declaration, and going on from strength to strength. So thank you for all involved in all that you do. Thank you.